YCN, your local view on WVBK-CA, serving Manchester, Londonderry, Vermont, and South Charlestown, New Hampshire, and WVBQ-LP, serving Charlestown, New Hampshire, and Rockingham, Vermont.
Welcome to the Upper Valley Chronicle. I'm your host, Ann Holmes. Today we are filming from Valley Terrace in Wilder, Vermont, and our show is sponsored by the VNA and Hospice of Vermont and New Hampshire. Many of our guests on this three-part series will address the changes in healthcare and what you need to know about your healthcare delivery. Today we will talk to Deanna Howard, a VP at Dartmouth-Hitchcock, who will talk to us about ACOs and regional healthcare and what the changes mean to the consumer and other positive changes happening at Dartmouth-Hitchcock Medical Center. Then we'll talk to Jeannie McLaughlin from the VNA of New Hampshire and Vermont about the important services offered to patients and families by her organization. And Dr. Marie Bakaitis from Dartmouth-Hitchcock will talk about her work in novel palliative care and her recent Brilliant Award by the Council for the Advancement of Nursing Science. When we get back from break, we'll be with Deanna Howard from Dartmouth-Hitchcock Memorial Hospital. Stay with us.
Looking for something to do? Find the most interesting people, local events, and unique businesses with Upper Valley Life. Upper Valley Life takes you up and down the Connecticut River, covering the community in which you live and all that makes it special. The magazine brings the Twin State region to your doorstep with award-winning local coverage. Find out more at uppervalleylife.com. Rediscover your hometown and this great area we live in with our family of publications. We want people around us who care, people who take the time to understand what we need. The staff at the VNA of Vermont and New Hampshire provide the best medical care and much more. Sometimes what matters most is a sign that someone is listening, a friendly smile, or a gentle touch. The visiting nurse and hospice of Vermont and New Hampshire. People heal better at home. Let us help.
Joining me now is Deanna Howard. Deanna is a Vice President for Regional Planning at Dartmouth-Hitchcock. Deanna, thanks for joining us today.
It's a pleasure.
Deanna is an expert in Dartmouth-Hitchcock and regional healthcare systems. She's here today to talk to us about ACOs and what that means to consumers. I know it's a big topic.
Yeah, big topic. And as you know, Ann, I'm a simple country girl, so we'll just try to keep this as simple as we can. ACOs are a product of the Affordable Care Act, and some people call that Obamacare. And some pieces of the Accountable Care Act start kicking in 13, some more in 14, et cetera. One of the pilots that they provided for in the Accountable Care Act was these things they call ACOs, and they're called Accountable Care Organizations. And so Medicare allowed for some applications to come in from usually health systems to try to figure out a new way of delivering care that would improve the value. And by that, we usually mean either contain the cost, bend the cost curve, and improve quality. Mm-hmm. So these ACO things are just coming on the docket now. We started in our first Medicare ACO January of 12. That's called the Pioneer Project. Mm-hmm. Not sure why it's a pioneer, but I was walking in the office one day and somebody brought the ACO team at Dartmouth all these sort of old Davy Crockett hats for our Pioneer application acceptance. So we're off at Dartmouth on our first one, and we were just partnered up with Fletcher Allen healthcare in Vermont, and we've been accepted by Medicare to do our second one, which is called OneCare, and that will be for the Medicare beneficiaries in Vermont. So we have a Dartmouth population in New Hampshire, and we'll be partnering with Fletcher Allen and all the other providers in the state, most of them, for OneCare.
Now, what does that mean to the consumer? Should they be worried about how that's going to change their relationship with their doctor?
Yeah, I think the good news is for those of us, you're too young, but for those of us who are working during the 90s, the commercial insurers, the Blue Crosses of the world and the Cignas, really made an effort to do what we call managed care. And in those older models, there certainly was an attempt to steer patients to stay within a network and only go to certain providers, certain hospitals. But this new ACO work, these pilots that I just mentioned, really the Medicare beneficiary, if you're on Medicare, you go to your regular primary care doctor, you go to the hospitals that you and your doctor choose for you to have your care, so there's no attempt to steer you. But what does happen to the ACO, and let's just think of Dartmouth as being an ACO for the moment, is that Dartmouth takes the risk with the federal government, with Medicare, to say, you know what, if we restructure the way we deliver the care for our piece of it, we should generate some savings. And the savings may be improved quality metrics, and it may be beating certain cost targets. And so that's where the savings come in, and if you hit some of those targets, you get to share some of that savings back to you who are giving the care. The downside is, because we can't steer patients, that if you know, your parents or my parents are in the program and they have a lot of care, and let's pick on Florida, Florida tends to be probably a lot more expensive than we are, and certainly not as well coordinated as our systems are, we think, in the Northeast. I hope nobody from Florida gets offended. And so that part of our patients' care, if they're in our ACO, could be quite expensive. So it may be hard to get that savings. So it means we have to do a really good job with all the partners in our region that we share the care of patients with.
And the idea for Dartmouth is to keep the quality good or better than it ever was, to lower your cost, which is good for the patient as well.
Absolutely. We think, you know, the old adage is that in the old environment, which we're still kind of in, we call it fee for service. So the incentive is just the same if you're a factory grinding out units of something. In healthcare, the incentive for making any profit, even if you're a not-for-profit provider, you have to generate enough money to update your equipment and recruit good people and all of that. The way to have generated that margin is really to do more. So do more CTs, do more MRIs, do more surgeries, do more this, do more that. And in fact, what is happened is the United States, out of all the countries in the world, does more CTs per 1,000 people, more MRIs per 1,000 people, more hospital admissions per 1,000 people. So our costs, we all recognize, are out of hand. 18 cents of every dollar we spend in the country of our gross domestic product goes to healthcare. Doctors, hospitals, nursing homes, too much.
Well, Deanna, thank you for explaining this to our audience. Dartmouth Hitchcock on the forefront of this program, saving money, improving quality for Medicare patients and all our patients. Thanks, Deanna.
You're welcome.
Next up, Mascoma Savings Bank has a few words about good banking practices. Please stay with us on Upper Valley Chronicle.
When we unveil the all-new 2012 M-Class, we're introducing a vehicle built upon 125 years of engineering excellence, which is why, no matter what is happening in the world outside, there is such a sense of confidence inside. Introducing the 2012 M-Class. Quite possibly the most advanced SUV ever. From Mercedes-Benz. The best or nothing.
Holloway Motor Cars of Manchester. BenzCars.com.
Simple solutions in a challenging world. Let Echo Communications make your life simpler. From the beginning, creating design, through the commercial print process, and ending with custom mailing, all easily coordinated in one place. Echo Communications provides simple solutions in a challenging world. One place, many solutions.
Tom, so many businesses are good at what they do, but they're not great on the banking side of the business. Are there products or services in place at Mascoma Bank that can help a business operate more efficiently?
You know, I think that really sums it up. People are so good at their product or their service, as we like to talk about. You know, they're very good at making the widgets and then selling the widgets. The problem becomes when they've gotten the money for selling the widgets, now what do we do with it? And, you know, unfortunately in today's busy world, coming to the bank, making deposits, writing out checks, paying bills, that sort of stuff can take up a lot of time. So really a couple of things that we like to talk about are Net Teller system and our cash management system. With Net Teller, you have the ability to see every single transaction that goes on within your account. You can see if a check is cleared, you can see if a payment has posted. All of your accounts at the bank, you can move money around between those accounts. Sort of the next level up from that is our cash management system. That allows you to move money not only between your own accounts, but from accounts outside of Mascoma Savings Bank. Perfect example of that is someone who maybe is a condo association. Instead of waiting for those checks to come in every month from their customers, they can go out and pull the money out of the customers' accounts on a regular basis. So again, it's just something you don't have to wait for the money to come in. You know when those timely payments are going to come in. There's just a lot of electronic systems in place that we can work with the customer and tailor for the customer's needs to make their job more efficient and effective. So essentially, they don't have to worry about the banking relationship. They can worry about making what they make.
Tom, my company receives a lot of checks, but that's not at the top of my to-do list every day. I heard there's a product at Mascoma Bank that can help deposit those checks without leaving my office. What's that product?
The product is called Merchant Remote Capture, and what we're really seeing is, although it's relatively new, it's not going to be that far, maybe 3-5 years from now, where the old way of depositing checks is really going to be old. Used to be, customer would bring their checks to the bank, and then from our various branch locations, those checks would get brought to our operations center, run through the big scanning machine, and all of that information would then get out into the federal system, and the checks would move along the way. Not surprisingly, with technology, that really has changed now. People, when they bring their checks to the branch locations, those checks are immediately scanned, and that image is sent out into the system. Merchant Remote Capture saves you that step of bringing the checks to the bank, and that you can have a scanner at your place of business, your home office, wherever. The customer scans the checks when they want to. Could be on a Saturday night, could be on a Sunday morning, could be Monday through Friday, 9 to 5. Really all we're looking for is the image. So they scan the checks. It's a great piece of internet-based software, and those checks immediately get put into the system. Customer doesn't have to leave their place of business and can do it on their own time schedule. So Merchant Remote Capture, if you receive a lot of checks, is certainly something to look into.
So what happens to the original document?
Right. One of the parts about Merchant Remote Capture is if you're scanning those checks in your home office, in your workplace, then of course, what do you do with the checks? We provide customers with a lockbox, if you will, with a box. It does become the customer's responsibility to maintain those checks for a time period in a safe and secure location. And of course, one of the things that comes up is, well, gee, how could I prevent my office from scanning a check twice twice. You know, you scan it, you leave it on the desk, somebody else comes along, scans it again. Not surprisingly, there's systems in place, both physically on the check and in the software system, that would prevent that from happening. And not surprisingly, there's a variety of scanners. Somebody who only receives a couple of checks, but getting to the branch location of Mascoma Savings Bank would become an issue. There's a scanner for that type of situation. If you're a municipality and receiving a lot of tax checks, there's a scanner that can process a lot of those as well. But long story short, merchant remote capture, if you have a check, you don't need to get to the bank anymore to get that check into your account.
Thanks, Tom.
You're welcome.
Thank you. Our next guest is Jeannie McLaughlin, the President and CEO of the VNA of Vermont and New Hampshire. Stay with us to hear about the exciting changes and the services this great organization can offer you and your family.
At H.R. Clough, we sell, install, tune, and repair home heating and cooling systems and deliver your fuel oil. But there's more to our operation than you see when we visit your home. Come visit ours and see the upgraded, expanded, and environmentally friendly fuel storage facility adjacent to our 24-hour-a-day credit card gas service. And from 6 a.m. to 10 p.m., a self-service automatic touchless car wash. H.R. Clough and Kearsarge Heating Oils. Over 65 years of local ownership and dependable service.
In 29 states, TDS is investing in the communities it serves, giving back to its customers, building networks that support vibrant local economies, introducing technology that connects homes and businesses, and providing exciting careers for thousands of people around the country and in your community. We're proud to be your local communications company, connecting you to more every day. Investing in communities. That's TDS.
Joining me now is Jeannie McLaughlin. Jeannie is President and CEO of the VNA and Hospice of Vermont and New Hampshire, and that covers a wide area.
It does. The agency is a good size. We cover both sides of the Connecticut River, about 4,000 square miles. So if you consider that, that's a good range. Although we cover very rural areas. We cover the most rural parts of Vermont. And we cover very rural parts of New Hampshire. We go down as far as the Massachusetts border on both sides, actually.
Oh, you do? And is that a challenge to have to cover all these teeny little towns in the backwoods and in the snowy hills? Is that harder than maybe an urban nursing agency?
No, you know, I've run urban metropolitan agencies, and what you lose or gain, what you gain from a rural area is you actually have roads to drive on that don't have a lot of stops, and you have actually driveways to park in, versus if you're in a more city, you're going through stoplights, you're looking for a place to park.
That's
so
true.
There is a balance to it. I think sometimes the geography in any New England town can be tough, but most of us are New Englanders, and we consider it a privilege to provide services to people in the communities that we serve.
And what type of services do you provide?
We have several programs that we provide services under. The largest is home care, and you can appreciate it's large because it's for those individuals who have an acute or exacerbation of an illness. So you may break a bone, you may have a surgery, you may have a wound, you may need an infusion for some reason. And those are typically short-lived. We come in, we provide the services through nursing or therapy, physical, occupational and speech, social work, home health aides for personal care services, and then there's an end to that. So that's why it's so large, of course, because most of us, have something and then it ends. We also have a good-sized hospice program, for which is very different. It's for individuals who are facing end of life. We support the family as a total unit and use an interdisciplinary team, which adds some additional team members, chaplains, physicians, volunteers are added to that. So it adds that complement for which supports that family, that individual towards that journey. And we have some tremendous success with that. It's symptom management, and I know people look at that, it's horribly sad. I've had family members who have had hospice before they died.
Right.
but it's such a support system to the family that it's just a wonderful program. And we, again, with our home care program, we service babies, which is unfortunate when it's hospice, and we service, really kind of birth to death, almost ages.
It is sort of a tough topic, the whole hospice and death and dying thing, but do you find people are more comfortable being in their own home than they are dying in a hospital?
I have always thought what has drawn me to home care for all the years that I've had the privilege of being in home care and hospice is that people do want to be in their home. I often speak with crowds of people and I ask them how many people go on vacation and bring a pillow with them, for example, and think how glad you are to be home after being away on a great vacation. Imagine being ill. So you can just appreciate how important it is for people to be home, also to be in control of their environment, that we're now guests in their home. We come when they invite us in. We come in, we are with their families, we're with their pets. And for them to have that familiarity and that control and that ability to have that, I think is very, very important. And as I say, I think all of our clinicians would tell you, it's the best thing. It's what makes us so passionate about what we do for a living, is that we have this ability to go in and become part of that family and to support them in the place that they live and in the communities that they live in.
And it's really a very personal, private journey, so
very much.
People being in the home and having such wonderful support it's just huge. I know we're going to talk to a nurse in your agency who has some great stories.
Yes.
But you started out as a nurse yourself, didn't you?
I am. I'm still a nurse. I maintain my licenses, and best decision I ever made in my life. I think to be able to provide care to people, to support them, to help them to find that place that's comfortable for them is, as I said, it's one of the best things you can do. I don't do much of it anymore. I occasionally might go and do a clinic for flu shots or do a simple visit, but the intensity, the acuity is so high, so much higher than it was 5 years ago. Having been in home care and hospice since the 80s, it's so different, the services that are provided now compared to even, again, just 5 years ago. So the skill set, the knowledge, the support that we provide to our staff is something that you just can't walk into it anymore.
Well, Jeannie, you run a beautiful agency, so many wonderful testimonials from patients, and we thank you for being here today and sponsoring the show. Check out the VNA of Vermont and New Hampshire. They'll help you with almost any healthcare needs. Thanks again.
Thank you.
When Upper Valley Chronicle continues, our next guest is Dr. Marie Bakaitis, who won the Brilliant Future Award from the Council for Advancement of Nursing Science. See you in a minute.
When it comes to home mortgages, you have a lot of choices, but if you want the advantages of a great interest rate, local decision-making, and being able to pick up the phone and talk with your mortgage specialist, your choice is Lake Sunapee Bank. Visit us today.
For more than a century, families have counted on the knowledgeable, caring people at the Visiting Nurse and Hospice of Vermont and New Hampshire during difficult times. When we're dealing with critical illness, coping with the limitations of aging, or recuperating from major surgery, we all want to be in the comfort of our own home. The Visiting Nurse and Hospice of Vermont and New Hampshire. People heal better at home. Let us help.
Your business is special. That's why it's important to surround yourself with people that can give you an advantage to help you grow your business. The commercial lenders at Lake Sunapee Bank have a reputation for doing just that. Get the advantage. Visit us today.
Joining me now is Dr. Marie Bakaitis. She's a nurse practitioner and associate professor at the Geisel School of Medicine at Dartmouth, and just won an award as a brilliant innovator in novel palliative care. It's very exciting.
Thank you.
So explain to us what novel palliative care means.
Well, the idea of palliative care, and most people don't even know what palliative care means. And so maybe I should start by just saying that palliative care is medical specialized medical care for people who have a serious illness. And it is a team approach, provides an extra layer of support for people who are facing, serious illness and all of the sequelae that go with that. So for them and for their family. So that's what palliative care is about, and it's a relatively new medical specialty, probably most recognized in about the past little over 10 years. And back when it first started, it was often confused with hospice care. And the difference between palliative care and hospice care is that actually palliative care is the overall umbrella of providing that extra layer of support to people with serious illness. We start doing that type of care when people are newly diagnosed with a serious illness, so heart failure or cancer or lung problems, things like that. When patients get farther along into their illness and maybe are closer to the end of their life, hospice delivers palliative care typically in the home. And so we're really doing the same kinds of things. Palliative care is sort of the overall umbrella. Hospice delivers palliative care towards the very end of life.
So somebody could be in palliative care for many, many years.
For years, absolutely, absolutely. And so sort of what was novel about what we've been doing is that, since actually 1999, which was our first research project, trying to figure out how to best deliver palliative care, we suggested something that was very radical at that time, which was to have palliative care start when people are newly diagnosed with a serious illness. And so in our case, it was with cancer. So a cancer that would likely not be cured. And so it was a new idea to think about, having that kind of care available right from the very beginning when people are still getting their cancer treatment, when their investigations, maybe they're getting, experimental cancer treatment. And so our team is there to try to help people, get through all of those really challenging.
And what has been the patient and family response to that type of support from the get-go?
Well, I would say that some people are a little bit nervous or curious, but and maybe because they think that, if their doctor referred them to palliative care, that maybe they're, sort of at the very end of their disease state, or their doctor's giving up on them. And actually, once they learn what it is that this team can provide, that often changes. I had recently I had a patient who has heart problems, and he was introduced to this idea of palliative care by his cardiologist. And so when he came to see me, he had already sort of had the information. And so I asked him what he thought about it. And he said, well, if you asked me a few months ago what palliative care was, I would have told you I want nothing to do with it, because I still plan on being treated and living a long and prosperous life.
Right.
But now I understand better from my cardiologist that this is going to help my wife and I to be able to cope better with the illness.
Right, right. So it's sort of an education on the patients and the families,
Yeah, it's an educational process because, and it's so great that people and shows like yours are there for public education, because that's the area that we really need to focus on much more, is educating the public to not be scared of us, that, we're really not here to, sort of force or push the very end of life, but we're here to try to help them through whatever that journey looks like from the very beginning.
And how would people get in touch with someone like you or your organization if they're outside of the Dartmouth system or they're not referred in by a physician?
Actually, I'm surprised at how many people have what we call self-referred. I am the principal investigator of a study. We call it Project Enable, and Enable stands for Educate, Nurture, Advise Before Life Ends. We have, this study is funded by the National Institutes of Health. And so we're on a website, and just like other clinical trials, like if you're looking for, something for your condition, your cancer, an investigational treatment, well, our study is advertised right alongside of those because it's a nationally funded study. And so people go on the web, and we've had people across the country want to, learn more about our study or participate, and also, so you can have access that way. You don't have to be, at Dartmouth Hitchcock in order to, or at the Norris Cotton Cancer Center in order to be treated. Also, there's a website, for the clinical palliative care team on the Dartmouth Hitchcock site, and so if you just put in palliative care and, are in this area, you're likely to find it. And we have people calling up the clinical service and saying, I want to learn more about this.
Right. Well, we're going to provide to our audience all these websites and Dr. Burkaitis' contact information at Dartmouth, so you can learn more about novel palliative care and remaining in just great quality of life no matter what your diagnosis is. Thanks for sharing this with us today, Dr. Burkaitis.
Great, thank you.
That's our show for today from the lovely Valley Terrace in Wilder, Vermont. Join us next week from the same location when we'll talk to Angela Warren, a much-loved nurse who has treated many patients in their homes. Angela will share her warm stories of patient courage and home health care in the Upper Valley. Jason Johnson will be here from Billings Farm to talk about winter and spring activities there. And Dr. Stephen Bartels, the medical director of the Aging Resource Center at Dartmouth Hitchcock Medical Center, will join us to tell us how you can take advantage of this well-regarded center to help you and your loved ones. I'd like to remind you that the YCN News comes to you every night at 6 p.m. and is replayed at 6:30, 10 at 10:30. Our YCN Game of the Week premieres every Sunday at 10:30 a.m. and replays at 1 and 5 p.m. This week, the Springfield girls basketball team travels up to Hartford. If you would like to be a guest on this show, give me a call or send me an email. I'm Ann Holmes. See you next week on Upper Valley Chronicle.